Hello, everybody, and welcome. I am so glad to have Bill Lucas with us, and we have been watching your commercials all over television. I know you have fun doing those.
I had a blast. When I actually contacted somebody to help me design the commercials that would help explain something so complicated as the Affordable Care Act, I got all of these requests and got all of these different notes that was going to take weeks and weeks and weeks to educate somebody. They'd have to see my commercial at least 15 times to understand what I was trying to say. So I sat down one evening and started drawing up and writing up exactly what I thought would get people's attention and explain this all in 30 seconds. And that's what we came up with.
And, you know, nobody knows our business like we do. And obviously, anybody that knows you for any length of time knows that, number one, you know your business. Number two, you believe in what you do.
And I love what I do. My main job is to teach people how your health insurance benefits fit. Think of a company. When you have a company, there's an open enrollment period. What they've done with the Affordable Care Act is create an open enrollment period for the average citizen to be able to look at their entire benefit package, how it affects them, and make choices. I sit with those people, or I have teams of people to sit with those people to help you make those choices.
What is open enrollment? What does that mean?
Just like with Medicare, open enrollment runs from October 15th till December 7th. And anyone who wants to change any portion of their Medicare, they have to do it in that date. Companies, if you work for a company, they have an open enrollment period where you get to make changes. This is your annual open enrollment where you get to make changes in your plan. The government has created an open enrollment in the state of Georgia and also multiple other states where you have the opportunity to make changes in your individual health insurance plan once a year. This is actually a great deal because a lot of times before, if you had a health insurance policy and you had a pre-existing condition, you couldn't change to a new policy. Now you can change to policies off the exchange or on the exchange with no pre-existing condition. Everything you've been treated for in the past will now be covered. That will not be an issue.
Wow. There's so many things out there. So let's try to narrow it down. What's the most important thing we should know about health care coverage now?
Health insurance coverage is out there for everyone. Everyone can buy health insurance coverage. That was not true before. You might want to have a plan that has really good benefits. You might want to have a plan that has a high deductible. Now you get to make that choice. The difference is who's going to pay for your insurance. If you work for a company, sometimes they're helping you pay for your premium. With the Affordable Care Act, it's kind of like that. This is why going from the group insurance market and tying in the individual market with the subsidies worked out best for us. We're explaining your benefit package, and for some people, you're getting a subsidy from the government, just like a company who's helping you pay your benefits. So your health insurance premiums could be a lot less than what you think.
You're helping a lot of people.
Thousands.
Thousands of people. Just between me and you, what's the secret?
The secret is to enjoy your job and actually give them someone to talk to. If you buy this on the Internet and you have a problem, you're going to call the 1-800 number and you're never going to talk to the same person twice. I've created where we have dozens of agents where when you have a problem, you call and talk to the person that you talked to who helped you to begin with. You don't have to start out with somebody new. You don't have to say, well, let me find the file and let's see if we can help you. You're talking to the person that you'll talk to this year, next year, and the next 5 years.
I was talking to Miss Jiva and Nanette Alexander this week.
They're wonderful
They've
people.
been with you for I guess, about 30 years.
Not quite, but about 28.
About 30 years. So, and one thing Miss Jiva told me was, he's just a phone call away. All I got to do is pick up the phone, and there he is. And that's not what you get, as you mentioned there, online or the 800 number where somebody don't even know you, and a lot of times really don't care, do they?
I have been coming to Dublin for 29 years. I have just a wonderful client base here. So me having an office here might be a new office, but we are surely not new to Dublin. And the phone call is the deal. We have everything taken care of where if you want to sit with someone in person, you can do that. If you want to do this through a webinar where we turn on our computer and you can see our screen, no matter where you're at, we can do that. If you just want to take care of this over the phone, we can do that. We've even got it computerized enrollment, just like healthcare.gov, except the only difference, when you have a problem, you don't call the 1-800, oh my gosh, do you think you can find out my problem? You just call us, and we can take care of you no matter what.
And word on the street around town, you used to hang around Ma Hawkins. Now,
absolutely.
That's how far back we're going here. So, is that true?
It is. I remember going to Ma Hawkins many times before they closed, and people would honk the horn. They actually thought I lived here. I was here at least every week, and people thought I lived here.
Yeah, and you actually eat there too, didn't you?
I did. I mean, I helped Herschel Lovett build a treehouse in the back for his kids. The kids are grown now, but I mean, I've been around a long time.
Okay, what about somebody with COBRA, lost their job, changed jobs, they've got COBRA insurance? Can they drop that and during open enrollment talk to you and get the coverage that they want?
During open enrollment, you can make changes. So if you have COBRA, we could sit down with you or talk to you over the phone, and maybe the plans that you could get off of COBRA might be better. One of the thought is they might be subsidized. Do you realize some people's health insurance can be free based on the Affordable Care Act because it's based on 21,000 pages of rules and regulations that we help you go through in just a matter of minutes to find out exactly how it affects you. If you've got COBRA, open enrollment is the perfect time to look at dropping COBRA because your deductible starts over in January with your current plan anyway. Now we have an opportunity to take those huge premiums and reduce them. If you just lost your job and you're now eligible for COBRA, call us before you sign those COBRA documents. Once you sign those COBRA documents, you are locked in until the following open enrollment.
Okay, we have a lot of people here, seasonal workers, people that are not U.S. citizens. Can you get health insurance through Bill Lucas Insurance with a green card?
Yes. If you have a green card, if you're here legally, if you're a U.S. citizen, we can help anybody get health insurance on or off the exchange. If you're not a legal resident, there are insurance policies you can buy, but it will not be on healthcare.gov or some of the standardized health insurance policies where the government might help you pay for it.
What about dental insurance? Would that be included in health coverage?
Health insurance coverage, some of the plans do cover dental, which is confusing because they cover them only for children. For the adults and really good dental coverage, it's something you have to pay extra for. We do offer dental. We offer vision. We offer, just like as if you were sitting down in your employer's company looking over the benefit package they would offer you, we have everything that you could have.
Okay, talking about employers, can you help my business? I got 5 people, 50 people. Can you help me insure my employees?
We do groups from basically 2 to 500. No big deal. What you've got to decide, though, is exactly what would you like to do. They have a study that came out the other day that 90% of all groups under 50 will drop their health insurance over the next 5 years. I am picking up pieces where people are doing the wrong thing all the time, maybe dropping it too soon, not looking at how it's actually going to affect the company. Somebody said I should do this, and they just do it without any research whatsoever. We come to an employer who has any number of employees, and we actually do what we consider an interviewing audit, where we meet with every employee, and then I bring a report back to you, the business owner, and say, you're going to hurt 15 people if you do this.
Wow.
You'll help 10 people if we do it this way. We can help 30 people if you do it this way. And that way, before you make a decision that I'm going to drop this, keep this, change this, I truly know how it's going to affect everyone in my company. Because sometimes dropping group insurance coverage is actually better for the employee. And that's the hardest thing for some employers to understand, because their real goal is to give you a job, help you give benefits, use those benefits to help attract and retain you. And so the idea of dropping this is they just cannot fathom why they would do that. And yet sometimes it's actually better for the employee and for the employer to do just that. But you really have to do your homework.
But you know the facts.
We have the homework basically done for you.
Yeah.
We've got it completely broken down to where it's very simple.
How long after I enroll does my coverage begin?
Good question. It actually depends on when you enrolled. If you enroll on December 15th, your coverage is going to start January 1. So for a January 1st effective date, you've got from November 15th till December 15th. If you enroll December 16th, your effective date is now February. And that works out through that all the way through February 15th, which is going to be the close of the time that you can actually get health insurance for the year 2015, unless they extend it. So right now, just assume you have 30 days to buy a January 1st effective date. And then we've only got a total of 92 days total to buy health insurance this year.
Okay, I've got private insurance. Can I change that outside of the open enrollment?
No and yes. If you have an older Blue Cross Blue Shield plan, as an example, that you had bought before January of 2014, your anniversary could be on a different renewal. So if your renewal was July 1, you could actually make changes on July 1st. Sooner or later, those policies will go away, and everybody's policy will renew January 1st. But if you've got one of the older policies that has an unusual renewal date, you can actually make changes then.
Okay, we've got an office here. We're right next to the Dublin Courier Herald, right downtown. You're convenient. What if somebody's listening now, they want to come by and talk to you? Do you have regular hours? Tell us what to do.
Basically, you can do two things. Walk in and come see us. The best thing to do is give us a call, book an appointment. Remember, 93% of the people we helped last year were over the phone. Why? Because when they came in, they did not have all of their information.
Ooh.
So we had to send them home and say, go get your information and
Not
come back. So a lot of times, people don't know everything they need to know. And so what we do is make sure they have the list of things they need, and then we can take care of them over the phone. Our phone staff works 7 days a week. This office on the weekends is basically by appointment only. But our staff works 7 days a week in different places because we're in Savannah Mall, Oglethorpe Mall, we're in Dublin, we're in Richmond Hill, Georgia, and we're in Macon. So if you want to take care of your paperwork today, then we can take care of it no matter what time it is. If you want to see somebody in person here in Dublin, just come during business hours or call and make an appointment.
Okay. Before we go, Bill, a lot of people going online, we mentioned that. But what's one of the biggest problems people have when they go online? Give me just a couple of examples of problems people are running into.
One of the biggest problems with the open enrollment system that the government has created, which is healthcare.gov, is it's going to list questions. Sometimes when you read that question, you've interpreted it differently. Let's say you're looking at your company insurance plan, and it says it's going to cost $1,000 to add your spouse and children. You might go on healthcare.gov and think, wow, I'm offered unaffordable coverage, so I can do this. Not necessarily. There's 21,000 pages of rules and regulations, so we believe over 2/3 of the people that do this themselves have made mistakes, and they're not getting a subsidy they probably should have, or even worse, you're getting a subsidy you shouldn't have, and you owe all the money back. By working with us, we can actually scale that down so fewer mistakes are made, and you actually know what you're supposed to do right from the very beginning. Also, the average person last year took 2 hours. Our team, less than 20 minutes.
Wow.
We have got this down to a science that we know exactly what every question means, and we can give you basically the interpretation of what they were trying to ask you.
You see how easy it is? It's just unbelievable. You get the right person, and I want you to pick up the phone right now. The number's right there on the screen. Call the professionals. You hear Bill talking to me, and we've just touched on a few questions. I mean, we're just having a conversation here, just some questions I had, but you may have a lot more sitting there at home say, well, he didn't ask this, he didn't ask that. Pick up the phone. The number's right there on the screen. Call right now. Bill Lucas, the professional, and I keep saying 30 years. Not quite 30. You keep scaling me back. I know
I'm
it's
not that
29.
old. I'm not that old.
I know it's 29, but I'm telling his age, huh? But somebody here in Dublin you can trust. Is anything that I hadn't asked you that we need to cover before we go?
We don't charge you anything to help you. Insurance companies pay us to help you. The price on healthcare.gov is the exact same price it is with me. We're dealing with the exact same policies. Our service is free to you. Now, with that said, we can help you with Medicare choices. We can help you with group insurance, small companies, large companies, and we can help you with the individual market. We helped thousands of people this last open enrollment, and we can help you today. Just give us a call or come by and see us.
You see why I like this guy, that free word? That is great.
Free actually works, doesn't it? It's free.
It really does. Thank you, Bill. I appreciate you so much.
And
Thanks for these questions.
coming by.
Yes, sir. Pick up the phone right now, folks. Call that number on the screen. Free advice and get you the best price possible right here at Bill Lucas Insurance, or log on at BillLucasInsurance.com.
Thank you.